DIVA Cats, the 2-year New South Wales Government grant-enabled project to provide desexing identification and vaccination assistance to low-income earners in targeted areas. We knew from our own data of demand for desexing assistance where the areas of high need were, and we knew that to target resources we had to impose limits, so these were geographic and income. We knew from research that cost is a barrier to desexing, and we knew from experience that cost is a barrier to desexing, and we saw what a difference cost could make to demand. We have a program called Adopt a Stray, where just for $100 we facilitate the adoption of a stray cat without the cat having to come into our shelter, by arranging for their desexing, vaccination, microchipping and registration. For a period in early 2023, we halved the cost to $50 and demand for the program doubled. So cost is definitely a barrier, and it's particularly significant for cats because they can start to breed at a very young age. So any delay in desexing can, and usually does, lead to pregnancy. Cat Protection has made efforts over many years to expand information and access to our services by producing materials in languages other than English, and you can find these on our website, including a directory of veterinary clinics where languages other than English are spoken. However, as a charity, our resources are limited and are mainly spent on direct services. So we didn't know whether the resources that we developed were reaching people other than from occasional direct feedback. With funding from DIVA Cats, we were able to commission specialist consultants, the LOAP agency, to research awareness and attitudes to cat desexing in culturally and linguistically diverse communities. DIVA Cats was provided in the LGAs of City of Sydney, with whom we've worked on cat welfare services for many years, and it's an area where we have established relationships and knowledge. DIVA was also offered in Fairfield City, again an area where we have worked with council over many years and have established relationships. We offered DIVA in Canterbury Bankstown because our own data showed this as an area of very high demand for cat welfare services and an area of high cat homelessness. Regionally, we offered DIVA in Bathurst, Lithgow and Narrabri, as we had existing relationships in those areas with vets and council through our regional Operation Cat program. Over the course of DIVA, services were extended to some other regional council areas to support individual rescues who were working alone to support homeless cat populations. Within Greater Sydney, some clients outside the target areas were supported due to great need. We didn't need to promote the program, as word of mouth alone created more than enough demand. Recording the source of cats meant we could map areas of high demand and identify hotspots, which you can see on the map, which is critically valuable information for future targeted desexing programs. Costs were capped per client, and we had many clients who were carers of populations of homeless cats, colonies if you like, and the cost burden on those people who are trying to desex cats is enormous, even with discounted programs. So DIVA was a huge financial relief for them. Ultimately, we exceeded our target of desexing 2,750 cats by more than 30%. Cat Protection significantly invested our own resources to achieve this outcome. In total, 3,675 cats were desexed under DIVA. In April this year, we held workshops and consultations with clients who desexed multiple cats under the DIVA program, and these revealed about half were sole carers of a colony and about half were part of a formal or informal rescue group. On average, each carer was spending about $100 a week of their own money to care for the cats, and an average of time of 7 hours a week looking after them. Most have been helping, desexing, feeding, trying to find homes for their community cats for about 2 years. So you can just see the enormous financial and time commitment these people have made, and rarely with acknowledgement or support. We owe them a debt of gratitude and great respect for their efforts. Low or no cost desexing is a benefit to individual cat carers and makes an enormous difference to carers of multiple cats. Participants told us that DIVA was a huge financial relief. I'm less worried, less stressed. Heartening to desex a colony, and the colony is happier and more settled. I've been able to bring home more of them. 100% of the respondents to the survey at the workshops we held said that the population of cats they dissect seem healthier, and 88% said there were fewer litters of kittens born, there was less fighting, there were fewer complaints from neighbours, and that there were fewer cats altogether. More than 1,500 cats dissected in the DIVA program came from the Canterbury Bankstown LGA and almost 1,000 from Fairfield. About half the residents in these LGAs were born overseas, and most households speak languages other than English at home. So we asked the LOAT agency to focus on these two LGAs to research barriers to desexing faced by culturally and linguistically diverse communities. It's important to note we're not seeking and did not seek to generalise or stereotype. The very concept of CAL communities has limitations and risks. The initial research was to identify the main non-English language groups in the LGAs to inform the focus of the consultations. Then those consultations included guided community listening sessions and community interviews, and workshops to co-design communication strategies to address barriers to cat desexing and to increase early age desexing. The process of bringing people together in a conversation about cat welfare is to start developing constructive relationships. And it's vital that consultations don't become compliance forums. They should be respectful and safe. You might want to ask questions such as, what do people know and think about the cats in their neighbourhood? Are they aware that kittens as young as 16 weeks can have kittens themselves? Do they know where to access services? Do they know the cost of desexing or how to access discounted services? Who do they trust to receive information from, and how would they prefer to receive that information? And I'll come back to the findings of our research. It was a hugely successful program and hugely challenging. DIVA placed a great demand on cat protection, and our capacity was tested. The phones rang non-stop. We had to engage additional staff to help us cope with the extra demand, and we had to train more staff to in how to register cats. We're an authorised registration agent, and we register all our cats, and it's very time consuming, and that's a lot of work. We were still offering all our usual services. So in the financial year 24-25, we managed the bulk of DIVA Cats. Some 2,500 cats in the program were dissected during that year, as well as adoptions from our shelter and our Adopt a Stray program of some 2,700. So it was a huge workload in this financial year. Disappointingly, councils didn't participate actively in the program, nor did they even collect data for us. While we've collected data and mapped it, there's obviously gaps in data, and feline welfare would be better served if all councils, pounds and shelters collected and reported and shared data. The veterinary workforce shortage and pressure on vets, especially in regional, rural and remote communities, is a barrier to accessing services. And I'd like to acknowledge here the contribution of vets to animal welfare services all the time and to the DIVA Cats program. The vets we worked with were outstanding, and I cannot thank them enough. Let's also remember the barriers they faced, starting with university and high fees, unpaid placements, with challenges continuing into the workplace. If you haven't already, I recommend you read the submissions and reports from the New South Wales Legislative Council inquiry into the veterinary workforce shortage. One of the major impediments to desexing unowned cats was the requirement to register all the cats in DIVA. Some councils impose limits on cat ownership, and a person caring for a colony can put themselves at risk if they have too many cats registered in their name. We sought but did not receive a waiver to register colony cats to the DIVA program, and we're hopeful that the current review of the New South Wales Companion Animals Act will address the impediments of the current registration system. Back to the work agency, we suspected that the barriers to cat desexing faced by culturally and linguistically diverse communities would be much the same as those faced by anyone, and primarily financial, but also we've consistently identified in our cat welfare research with Ipsos, thinking that cats are too young to be desexed. But these challenges might be compounded by barriers relating to language, cultural norms, knowledge of animal welfare services, economic or housing factors, and religious or philosophical beliefs that might affect perceptions of desexing. The aim was to identify key populations so that limited resources could be used effectively, and to engage in conversation with people from those groups about cat welfare issues. The LGAs of Canterbury, Bankstown and Fairfield, the key language groups are Arabic, Vietnamese, Mandarin and Cantonese. It's really important to emphasise that sharing a language or sharing a religion doesn't necessarily mean sharing other attributes. Or people, like all cats, are unique. There are also generational differences, which are probably also mirrored across communities, such as younger people, especially in urban areas, tending to regard cats as cherished indoor pets versus older generations who are more likely to see cats as independent agents and very often as pest control. Spending money on cats is sometimes seen as a misplaced priority. Again, that's not unique to any cultural linguistic group and is probably more likely influenced by financial hardship. The research and co-design workshops told us that the messages are best received from trusted community sources, such as community leaders, faith leaders, community radio, and local community centres, and so on. The priority messages for cat owners were that desexing is an act of care and protection, and that it can and should happen before 12 weeks of age. And for informal cat carers, the message is that cat welfare services are an ally, willing and able to help, and that informal care is a legitimate and valued form of protection. A strong theme emerged in faith-driven communities, which was mirrored in our DIVA Cats workshops, which was that caring for cats is a moral duty. People said things like, I love all God creatures. It's my responsibility to look after them. I'm an animal lover. I hate seeing suffering. I can't deny their hunger. To improve equity in access to cat welfare services, we need to acknowledge and provide support for cat carers, and we must be welcoming and non-judgmental. It's so important to collect data, use the data you've got and keep adding to it. Reflect on your own practices. What do you do to actively reach clients? How do you make people feel welcome? This has been a huge project for us. We're still processing all the findings and work, and there is much yet to be done. We need to do follow-up work with the LOAT agencies, reports, and implement communication strategies, and we wish to do more work with the amazing cat carers we met along the way. But so, we will keep you posted. Keep an eye on our website. Thank you.